briefing for members of what we call the BME media. You just call it media, I'm sure. But there we go. And I'm pleased to say we've got two real experts to talk today. First of all, we're going to be joined by Dr. Lola Abudu, who is the Deputy Director of Health and Wellbeing at Public Health England for the West Midlands. And then I'm very pleased to say that we're going to be joined by Mubashir Ajaz, who is the Head of Wellbeing and Prevention for the West Midlands Combined Authority. And he, of course, will talk about our report into the regional health impacts of COVID. Then it's all about throwing it open for any questions that you want. So the way we will do that, if you could remain on mute while Lola and Mubashir present, and then if you want to ask a question, if you just put your hand up in the time-honoured way, I'll try to see that and call. Then when we come to you, if you unmute, and as we've already said, we are recording the presentation. So no more ado, I shall pass over to Dr. Abudu just for her read of the COVID situation across the region. So Lola, the floor is yours.
Thank you very much, Mr. Mayor. All I'm going to do is really just to give some top line figures and really then focus on what we can all do to slow the spread of COVID-19. I'll start first of all with just the figures from the numbers of people who've tested positive for COVID in England over the last 7 days. That's about 138,005 people, and cumulatively there have been 43,826 deaths. In the West Midlands, the number of new cases of COVID over the last week is 18,348. And since the start of the pandemic, tragically, we've lost about 5,297 people to COVID. And my sincere condolences go out to families and communities who've lost loved ones, and our thoughts remain with them. It's shocking to know that there have been over 1 million people across the country who've been infected with COVID since the start of the pandemic. And this has led to serious illness and even deaths in tens of thousands of cases. And we know that communities are making huge sacrifices, and the situation is becoming increasingly precarious as we have more hospital admissions each day, not just of COVID patients, but those who are suffering with other winter illnesses. We're now in a 4-week national lockdown. This will help to slow the number of cases, but we all still need to do everything that we can do to make a difference, whether we're just going out doing food shopping or picking up children from school. It's really important that everybody abides by the restrictions in place, by socially distancing, wearing a face covering, and regularly washing their hands for at least 20 seconds. I know this lockdown is going to be particularly difficult given the time of the year with such short days. There will be those whose mental health will suffer. Domestic violence can become an issue, particularly when families are having to remain in confined spaces. Folk are going to be worried about not seeing their loved ones, and so we all have to do our best, really, in this effort. I know Diwali is coming up soon, and really I'd be encouraging folk to really bear in mind the restrictions, maintain social distancing, so that we can have a safe celebration. So that's all I'll say for now, and happy to come back later to pick up any questions.
Lovely. I'm sure there will be questions for you, Lola, so look forward to that. And next, we're going to turn to Mubashir, who, as I said, is our Head of Wellbeing and Prevention for the West Midlands Combined Authority. And just to say, the timing of this is perfect, because this Friday, the Combined Authority Board will actually debate the report that Mubashir is going to talk to. So the floor is yours, sir.
Thank you, Andy. Olivia, if it's possible, can you please share the slides? Thank you. So I felt that presenting a slide set might be a best way to go through the report really quickly, because it is a comprehensive report, and we don't have the time to actually go into every bit of the things that are in there, but I'm going to try and present some highlights to you today. And of course, there's going to be a period for you to question on the back of that, and I'll try my best to answer as much as I can. So we commissioned, next slide, please. So we commissioned a Health of the Region report for West Midlands before the pandemic got really, really worse. And when it started to look like it was actually becoming this big thing that everyone was now impacted by, we decided to say to actually focus the report on the regional impact of COVID-19 on the health of West Midlands residents and communities. And so there's a task and finish group that was set up. We had partners from across the West Midlands, from Public Health England, from NHS bodies, from universities in the voluntary and community sector. The group published an interim report back in August, on the back of which we went out for further evidence from various community groups, organizations, to actually get into the crux of how the system was responding or dealing with the COVID-19 pandemic. All of this has now been brought together, the data has been analyzed, and we've come up with the Health of the Region report, which is going to the WMCA board tomorrow to be debated and finalized. So what I present to you today is confidential. It is in draft format because it is not a signed off report as yet, but we find it we're really keen to share the findings and early and get your opinion and advice on it as well. So it should be noted a couple of things, that it needs to be read in conjunction with the State of the Region report, and it serves as a call to action for our partners within the region to address some of the long-standing inequalities within our region. Next slide, please. So why is it important? I think on the back of the Public Health England report, reports in June, where it was seen that there are higher disproportionate impact on certain vulnerable groups of COVID-19, we were reminded of all of the inequalities that exist within our system, within our services, and this presented a really good opportunity to look at some of those inequalities and help address some of those, what we call causes of the causes, the things that lead to our ill health. And so that's what we've tried to focus on in this report. And for those of you who are aware of Sir Michael Marmot, there's a wonderful quote there from him, but he's been talking about this for years, and as have most of us from the health and care system. However, it's just, we want to use this opportunity to really make a difference on these going forward. Next slide, please. So in terms of inequalities within the CA, within the West Midlands region, you'll see that I'll try and summarize this graph here for you. It's essentially showing that we have poorer healthy life expectancy, both in men and women, as compared to the national average. Next slide, please. And some of the causes of those ill health or early death are actually preventable, and most of them, you'll notice that the leading causes of death are around cancer, cardiovascular disease, liver disease, respiratory diseases, alcohol-related mortality, and drug misuse. And the kind of immediate causes, it'd be great if we can mute, because I can hear some, thank you. So some of the causes behind them are, the immediate causes are around smoking, obesity, and both in adults and children, physical inactivity, and lack of screening. And so again, within these, we've highlighted how the region is performing as opposed to the national average. And you will see that we have areas of concern in that. Next slide, please. The thing to notice, though, is this is a long-standing issue that is across the life course. So it's not just in adults, it's not just in childhood, it goes on through the life course, and we need to address some of these issues that we've been highlighting in this report. Next slide, please. So what lies behind those issues is
can I just jump in a minute, Monsieur? Somebody's got a little baby. It's lovely to hear, but maybe not just at the moment. So if you could just go on mute, whoever's got the baby in the background, that would be brilliant. Okay, thank you. Okay,
thanks,
that's
Andy.
as fast as you can, Monsieur.
Yes, absolutely. So what we wanted to talk more about were some of the causes behind those issues. So yes, smoking can lead to cancer, but there are reasons behind why people might be in a situation where they cannot stop smoking. And some of these factors are what we call upstream factors, and they are around the socioeconomic conditions that we live in. Next slide again, please. And some of these causes are around housing and employment. They may be around income. They may be about the conditions that we live in. Keep going, please. Next slide. And when COVID-19 hit, all of these issues actually came to light again, like I mentioned, and became exacerbated, especially in some of our vulnerable groups. Next slide, please. So what we've seen from national numbers is that there's a higher likeliness of death from COVID-19 for certain community groups as compared to the white population. There are higher hospital admissions. There's higher mortality level. Within the West Midlands, we have higher increased levels of anxiety. We have 40% women doing less exercise, and we have more women than men reporting worsening health condition. Next slide, please. So what we have seen in this report and from other pieces of work around the region is that we definitely need to take some steps to tackle some of these structural inequalities that specifically are faced by our BAME communities. And one note on BAME at the moment, we have used this term throughout, but we recognize that this is a debated phrase. Some people prefer to spell out Black, African, Black, Asian, and minority ethnic, or some actually use ethnic minority groups overall. The reasons being we don't want to hide the experiences of individual groups within this collective phrase. However, for the moment, given that it links up with all of the policies and documents that are nationally available and there is no alternative, we are going to continue to use the phrase BAME. Next slide, please. So that, we then go into some of the opportunities for change. And I would really like to just actually go into the commitments, please. So if you can go forward all the way to the slide where we are talking about. So we've identified 4 key areas of challenge areas from the report, and these are around improving outcomes for ethnic minority groups, around tackling the wider determinants of health that we mentioned earlier, the causes, widening access to health and care, and around people-powered health, where we actually focus on using some of our community assets and getting our community to focus more on their health. And what we've done is we've galvanized the region and our partners to produce some commitments to action within these challenge areas. And as a collective, we want to present this to central government with some recommendations on how they can help us improve some of these outcomes in these challenge areas. So some of these commitments are listed here. They're just a selection of them. And when the report does come out next week, you'll be able to see all of the 50+ commitments we've received from partner organizations. Next slide, please. Again, next one, please. So some of the recommendations, and one more. Some of the recommendations to government include things like wanting the government to commission further data and research analytical work at the local and regional level to understand the impact a bit further, help us invest in some of our prevention funds to be able to address the inequalities that have been identified. We want the government to be able to double the prevention proportion of health and social care spending focused on prevention and public health. And so these recommendations will be debated tomorrow at the CA board, and we should be able to finalize a set of key recommendations in these challenge areas back to government and hopefully receive some further support for our region. So that was a really whirlwind tour of the report, and I just wanted to present to you some of the key issues that we've identified and that we would like to address going forward. And I'd like to open the floor back up, please, Andy, for any questions that might follow.
So Mubashir, thank you for going through, and I hope what people see from Mubashir's summary is it's a very honest report, but most importantly, it tries to move to action, both that we can control and that we can request and influence. But let me throw it open to questions. And Mubashir, while you were talking, the first question was actually put in the chat box by Tony. Now, I think I might just ask Tony for you to introduce yourself and which organisation you're from, because it's not quite sure just from your first name. So, Tony, do you just want to reveal yourself and put your question? And Mubashir will answer that one, I know.
Yeah, hi, good morning, Andy. Good morning, comrades. I'm a journalist and broadcaster, and I represent Aapki Awaaz, a local hyper radio station based in Alum Rock. We've seen the damning report from Dame Lawrence, and of course, with the earlier report in June 2020 from the WMCA. Just a quick question, and just to hopefully if you can get clarification and transparency, did that report take into consideration into your further inquiry?
Yeah, Mubashir?
Yeah, so we had a group of us were actually analyzing the report overall, and there were different pieces of evidence that we collected from the region as well as national reports. And so while I cannot say for sure that that report was referenced within the report, I don't think it is, but it was taken into consideration, that one as well as a couple of others that came out while we were writing the report. However, the call for evidence period was from before that report was released.
Okay, is that clear, Tony?
That's fine, thank you.
Thank you very much. Okay, so that was the only question in the chat box. So let me see if anyone wants to put their hand up as to who'd like to ask the next question. I've got a few. Now then, let's go to, I think the first was LC, are the initials on my thing, which I think is Laura Codling from Eastern Eye, if I'm working it out correctly. So Lauren, sorry.
Good morning, sorry, it's Lauren.
Yeah, Lauren, not Laura, I can't read. Yeah, okay.
Oh, that's okay. Yes, morning all. Yeah, so I am a news reporter from Eastern Eye. So I have a couple of questions relating to the test and trace scheme. So I understand that yesterday Baroness Dido Harding told MPs that the programme has failed to anticipate the rise in demand for testing it as schools and universities have returned for the autumn. A couple of questions in relation to this. So first of all, could you give me some insight into what you believe has worked with the scheme and what hasn't? And also, do you believe that the supply is matching demand now?
Okay, I will willingly give you my view, but I might ask for Public Health England's view as well, because you probably don't want to hear a political view. So let me pass to Dr. Abudu first, but I'll also give you my view. So Dr. Abudu.
Okay, thank you very much. Just to say, PHE local health protection teams currently support the tier 1 element of the test and trace service, and the other tiers are provided through Serco and NHS professionals, so there are a range of people who are involved in them. Certainly, I think from our perspective, the tier 1 service, working closely with our local authority colleagues, has worked very effectively, I think, throughout the pandemic. Obviously, as demand has risen, there have been challenges, keeping up with this. certainly, we are now moving into a new phase where we have mass testing pilots happening. All of those things will increase the demand for contact tracing, and we are using the period of national lockdown to review the way, my understanding is that we are reviewing the way things will work during this period so that we can most effectively support the new modalities as they come in, taking a much more integrated approach across all of the tiers of test and trace.
Okay, so thank you, Laura. I'll just give you my view as well, Lauren. Now, this information is a few days out of date, as it always is, but I'll just give you this. So the number of tests being done in the West Midlands per day, that's the WMCA area, is about 10,500. So that comes up to just over 70,000 a week. And if you compare that with the national rates of testing, it is actually extremely good. And all of our local authorities have got testing rates. So the importance of that is it gives us confidence in our statistics. It's also true to say here that if you want to test, when you say is demand currently being met, if you want to test, it is being met. So we have not got reports of long delays there at all. So that's a good situation. In terms of what has worked and what has not worked, the thing I'd like to call out, because there's a principle here that's worked really well, has been the local element of the tracing. So actually the contacts that are passed over, and again, this applies to all 7 of our local authorities, the contacts that are passed over are overwhelmingly followed up at contact rates of between about 97 and 99%. The piece that has been less good is obviously the proportion of, this is a national statistic, not a statistic in the West Midlands, the proportion of people who are isolating for the full period. I've got no reason to believe that our data is any different to the national data there. So hopefully, Lauren, that answers your question with a little bit of the local flavour with data. Do you want to come back to either of us?
No, I do have a couple of other questions, but I suppose I'll let the other journalists just get in there.
We'll come back to you, Lauren, if we can.
Yeah,
okay.
Great, thank you.
Right. Now, the next bit of detective work on my part, ID, I think the initials ID may belong to Indy Dial of Desi Blitz. So, Indy, is it you?
It is. Thank you, Andy. Morning, everyone.
Okay.
Thank you for your presentation, Mubashir, Lola. Really good stuff going on there. My question is actually fundamental, I think, to the report and the basis of the report, and it's about the misinformation and fake news that's been spreaded more recently now due to COVID. So all of you may have seen the WhatsApp videos, the Facebooks, etc., relating to 5G and the impacts of 5G and how that relates to COVID. And I guess my question is, I didn't see how we're tackling that. I didn't see how we're going to ensure that people respect the information in that report and hold it as trustworthy if we don't tackle all the fake news that's being spread, especially within British Asian communities, ethnic communities. We at Desi Blitz have done a number of things to try and tackle that through basically going out and speaking to members of the community and asking them how they've been affected. So it's all evidence-based kind of reporting and information. So how do you guys see that fitting in? And is there any steps or any measures that you've taken to try and address that?
It's a great question. I'll pass to Mubashir, but I'll give a little view on it as well. Mubashir?
Thank you, Andy. Good question, and indeed we are aware of the fake news that is being spread out there, or especially in relation to COVID, and also in relation to some of the vaccines. In fact, I received something the other day myself that I had to debunk, and that was from my own uncle. So it's these things happen, and no, it is not addressed in the report specifically, but what the report does do, and I hope when you do see it, you'll notice that we have some really good case studies of community work that's happening, and some of the, both around the impact of COVID-19 as well as some of the recovery work that's been happening by our partners, especially within the voluntary sector. So when you see the full report that comes out next week, you'll definitely see that in there. What we also hope to do going forward is continue to work with our delivery partners on any concerns that come up in terms of barriers that may be may exist, and this is what I would call a barrier going forward. But again, that's for something to follow from the report. The report itself was very much focusing on how COVID-19 has really impacted our region in terms of the health numbers, as well as in terms of some of the work that has come out from it.
Thank you. And Indy, it's a great question. Just let me add to it two things. First of all, on the 5G stuff, which was concentrated here and Liverpool, unfortunately, the tech, hopefully people can quite quick off the mark in trying to, dispel the fake news, because it was so damaging, actually, because one of the lessons of COVID is we all need the new technology for keeping people informed. So, but it draws out a general point, actually. You on the call have the power over this almost more than me, actually. So I really want to draw all of your media organizations into telling the stories for even more than we've done in the past, actually. And Lola's nodding at me. And if I could, I'd finish with a sort of unashamed plug there that every Friday we do a media briefing on all the stuff in the West Midlands, and we have the hospital CEOs, PHE, everybody. But we don't have many of your organisations represented because you're the people with the access. So I would really like you to be there to help us in dealing with this fake news, if that doesn't sound unreasonable, Indy.
No, and thank you for the follow-up. I'm really looking forward to seeing the rest of the information when that comes out. But we're more than happy to keep plugging away and keep supporting where we can. Obviously, we're a small team as well, so the resources at this present time aren't the way they were before COVID. But we're more than happy to support. And as I said, we're already in the throes of doing a large project. I think Faisal already mentioned that before I came on the call.
Yeah.
Or just as I was coming onto the call. So yeah, no, we're always happy to help and good work. You know, I see lots of good happening, from this, and you guys were really quick to respond, Andy, as you quite rightly said.
Well,
I think there's just so much more to be done, because it just seems that every time something else happens, there's a whole host of more misinformation that comes off the back of that. But we really need to tackle that as a wider issue.
Absolutely. Lovely. Okay, and we'll come back to your organisation in just a minute. But next, it was Irfan from WNTV. So Irfan, the floor's yours.
Thank you so much, Andy and Dr. Lola and Mubashir Ajaz. My question already, Dr. Mubashir Ajaz, I think, mentioned his report. Health inequalities has led to disproportionate number of BAME deaths. How are you increasing support for the Asian community at this difficult time?
Yeah, okay, great question. Yeah, Mubashir, that's definitely part of the recommendations, isn't it? So yeah.
Absolutely, thank you. Yes, so we are, as I mentioned, we've divided the report up into, we tried to summarize the report into the 4 key challenge areas, and one of the biggest challenge areas is the impact on the BAME community and improving the outcomes for BAME community. So when I mentioned BAME, we're talking about not just Asian groups or Black groups. We're talking about all vulnerable groups really within that category, but particularly the ones that have been highlighted in both the national reports as well as some of the regional stats that we highlighted in the report. We understand, there are higher rates of death for people from Black communities, from Bangladeshi community, from Pakistani community, and clearly we're going to focus particularly on those areas, but we also understand while we don't have the regional numbers for the number of deaths for those particular groups, we do understand that we have a higher than national average of ethnic minority groups. We have a higher than national average of areas, deprived areas within the region. So clearly all of these taken together means that we definitely need to focus a bit more on the outcomes for Black, Asian, and minority ethnic groups.
Okay, and Lola, you want to come in?
Thanks very much for that, Mr. Mayor. As Mubashir says, there are a number of different areas of action, and we need to deal with the underlying health inequalities, whether this is, economic, housing, etc. But there are things that we can all do. And it's really, one of the things that we know that this excess mortality is related to is long-term conditions such as diabetes, hypertension, and the like. And these conditions are more prevalent in some of our Black and Asian and minority ethnic communities. And it's really important that we galvanize our communities to manage, their long-term conditions, respond to your NHS health check invitation, all the things that we can do in terms of improving our diets, taking regular exercise, which is good for both our physical and mental health, managing your diabetes proactively. These are all things that we need to be really sharing and encouraging our communities to do, because it's not just good for you here and now, but it's also making sure that, you are less susceptible, as it were, to the more severe illness that can happen through COVID. So we do need to do those sorts of things and enable and facilitate people to access the services that are available at the moment.
Lovely, thank you. Irfan, anything else you want to come back on?
No, thank you so much.
Thank you very much for your question. In which case, next, and we've got quite a lot of questions, I'm going to ask everyone to be brief in both answering and asking. So next we go back to Desi Blitz and Faisal. Floor's yours.
Thank you. Thank you, Andy, Mubashir and Lola for today. Just following up from something that I did mention earlier on. Now, we've created a COVID-19 project to work in native South Asian languages using the strapline, spread the message, not the virus. Yeah. How can you help us with this? And are there any areas that you guys feel that we should be looking at? I mean, there's a lot of areas that we are looking at. And in addition to that, how can we further tackle mental health? Because there's a lot of people during this very difficult period are suffering in silence.
Yeah, okay, last bits, well, both bits are very important. So Mubashir, do you want to go first?
Actually, I'll let Lola go first on this one.
Very dignified. Okay, Lola.
Thank you so much. I mean, you've raised a really important issue, Faisal, about people's mental health. And we know very often our communities are not really the most backwards in coming forwards, as it were. And these issues have stigma associated with them, and we need to dispel some of those myths. There is a huge range of useful resources on Every Mind Matters, which PHE has recently published. We have within that there resources for all sorts of common mental health conditions, really helping to educate people about their own mental health, but then also how they might be able to help other people as well, and also resources to enable parents and guardians to support children and young people. And those resources are easily available on our Every Mind Matters website. And then also the NHS has useful resources that people can use. I think the other thing that I would encourage is physical activity again, because we know for people of all ages that physical activity does make a huge difference in terms of our mental health, and we need to be encouraging those folk within our communities that are less likely to be physically active, to get more of that activity going, and to help during this difficult time.
Probably worth me just chipping in, Faisal. One of the WMCA commitments in the draft paper is specifically around what we can do with our Thrive programme. And just again, competition of resources. If you want to go and look on the WMCA website, we did at the beginning of the pandemic a piece of work we called Thrive at Home, to take that resource and make it applicable to people who were suddenly having to work from home or stuck at home. So there is resource there right now to pick up your very important point. But Mubashir, anything you wanted to add?
Yes, thank you, Mayor. Thank you for mentioning that, because that was one thing I was going to say, that we do have a specific recommendation. No, perfect. That's brilliant. You know the report in and out. I'd also like to highlight, I think, some of the excellent work the community has been doing, and it has been proven to be effective in reducing the impact of COVID-19. So community champions which you guys are one of the key ways for us to fight back against the virus, and for you to be able to continue to do those programs and dispel some of the rumors and the myths that might be in the community, and help spread some of the official messaging around the prevention of COVID-19. So please note that the kind of work that you guys are doing is actually recognized as one of the key ways in fighting back against the virus.
Brilliant. Faisal, anything you want to say?
No, thank you very much, Mubashir, Lola, and Andy, for your thoughts.
Thank you very much. In which case, again, I'm trying to work out AR initials. I think that is Asian Voice and Rupanjana. Am I right? AR initials, hand up. Okay, that didn't work very well. AR's put a thing. We can't hear you, AR. No. So you've put a message in the chat box. Just let me click on it and then we'll read it out.
And Andy, just to say, we do have a translator on the call. If you like, I'm happy to put that in the translation.
Okay, that's brilliant. I don't think the issue's translation. I think it might just be technology, actually. So I'll be very quick. Rupanjana writes from Asian Voice. The West Midlands has forged a new relationship with India through the recently formed West Midland-India Partnership. Recently, a financial rescue talk between Tata and the British government failed. Andy, you spoke about business in distress, asking for more assurance from the government. As the case increases, specifically in Birmingham, and it shows the Asians are badly affected, do you think the relationship will go ahead as planned? Right, that must be for me. So thank you very much, Rupanjana, for the question. So the answer to will the West Midlands India Partnership go ahead? Categorically, yes. Whether we can have the public events, the answer is probably no. But behind the scenes, the work is continuing absolutely at pace. Example, the recent decision by TVS motorcycle company to buy Norton and actually set up their new facility in Solihull. And I'm very pleased to say they would say that we've been incredibly supportive in that, and there'll be a moment to celebrate that. So actually, long term, I would say it's even more important that we forge this relationship with India rather than less, if that makes sense. And I'd probably move on from that, if you don't mind, Rupanjana, because there's a lot of interference on the line there. And next we are going, she says, thank you very much. That's brilliant. In which case, next we are going to go to, I wanted to go to Samra. Where are we now? Sama News, to Taimur Shahzad. Taimur.
Yes, Andy, thank you very much, all up and good morning. I will ask you one question to take a little bit behind the scene is the pandemic situation. When this first case is coming in November, why is the government come late? They take a decision in March. So that's the first reason will become an end of this result. We're the second largest city in the world. We affected this COVID is a pandemic situation. One is the government take before the measurement December, January, February. Why is it late? Second is the question is the national lockdown, the second lockdown is going on. Why is the school not closed? People, mostly parents are worried about for the kids. And in my situation, which one I know is basically 2 schools, whereas my children is going. Their class is closed because some of kids have a COVID is a positive test. Why not their government is forcing to lockdown in this situation? Is the school is closed?
Thank you. I think, Lola, I need to ask you about both of those because they're both public health messages. School closure, why is the decision as it is? And then back, why did it take us time to move at the beginning of the year? So, Lola, do you want to pick up the schools one?
Okay, so in terms of school closures, really the decisions that have been made are one about the well-being of our children and the importance of ensuring that we maintain their educational progress, but 2, the epidemiology was certainly showing that it wasn't young people that were the problem, and therefore, from a policy perspective, the government has chosen to close down other parts of society while or restrict other parts of society while enabling children and young people to go to school. I think from a BAME perspective, this is something that we need to look at positively because we know that very often children and young people in BAME communities are not making as much progress as we would like, and it's really important that they are able to continue with their education. We know that education has a very important impact on health outcomes, and it's really vital that children and young people have access to education and access to the other supports that are available through going to school on a regular basis.
There we are. Does that answer your question, sir? You're on mute. You're just on mute, sir.
Yeah, sorry. Yeah. If the alternative solution is there, they can do the online classes in this situation. Why not they going to the online classes?
We know that there's a huge digital divide, and so not everybody has got access to tablets, Wi-Fi, and all the rest of the things that we need to be able to do that consistently. And so I think I was just listening to the news over the last week with head teachers coming out to say that they think that children have not only lost out in terms of their education this year, but they have regressed some up to 2 years. And you know, the young people really don't have access to the tools that they need at home in terms of tablets, laptops, Wi-Fi to enable them to be educated fully online.
Okay, thank you. We should move on from that, in which case I think the next questioner is FC on the box, and I'm trying to work that out. Is that Farsu Chowdhury from NTV, FC?
Yes, sir. Thank you very much for the chance to meet with you. And lastly, I am sorry I joined late. Just trying to know for the business community, we heard that rent value of the business will get the grant, but people always asking me, the business people in our Bangladeshi community especially, when will they can apply for this scheme, and we haven't got any answer.
Yeah.
And
okay.
Other things, you know, last time you have provided us and the business people a discretionary grant.
Yes.
And have you got any facilities for those businesses, especially for the discretionary grant, whichever last you have provided to the business people?
Right. Thank you very much for this question. I'll answer this one. What we will do, by the way, after this, if one of my team can make sure this happens, we have done a summary of what business grants are available, and we will shunt that round to everyone who applied for this. So, Suki, if you can make sure we get that, because I do know it is complicated. To try to summarize and answer your question straight up, every business that was in a tier 2 area, so that was Birmingham, Solihull, Sandwell, Wolverhampton and Walsall, they will get a grant directly for that period. That will be administered by the local authority, and that will be automatic. And then when we moved into the national restrictions, they also get a grant per month for, again, that is automatic, and everybody gets the same. What there will also be is a discretionary grant scheme administered by the local authorities. We do not yet know the criteria of that, and the local authorities will do their publication of that in due course. But there is definitely both the tier 2 grant for October in simple language and the national lockdown grant for November in simple language that will be available to small businesses across the region. And we'll send round the details of exactly what those payments are. I hope that's clear, Farsu, yeah?
Thank you very much, sir. Thank you very much for your hard work for our local community. We are really very appreciate for your work and being a meeting with you the chance. Thank you very much.
Thank you. Thank you. Now, the next person I see who's not yet had a question is LJ Hunter. LJ, your question's in the chat box. Did you want to say something else, though? You there, LJ? You put your hand up, but okay. My computer won't allow speech, LJ. Thank you very much for sending that message through. So the question that LJ's put in the chat box is really, why do we think that this report will be heard when other reports have not been heard? And I'm going to put that to you, Mubashir, because it's obviously the underlying question. So, Mubashir.
Well, I mean, we hope that the fact that we have over 50 commitments from wide-ranging organizations within the West Midlands region committing to take actions towards the 4 challenges we've identified, and then use that as a regional clout to lobby with the government to actually assist us in taking those steps forward is a wide-ranging response. I suppose it is how it lands, I suppose, depends on external factors. But what we've done is we've tried to make sure that we had a wide range of representation within the report. We went out for a call for evidence where we had multiple voluntary organizations and regional partners bring in evidence. We have, while we have not named specific reports individually within the report, we have taken the lessons from them and applied them and tried to present a view of what we think are the key areas impacting our citizens within the region. So I suppose, in a roundabout way, what I'm saying is we are working as hard as we can for this report to be as influential as possible. And we will do whatever we can within our power to address some of the concerns. And the other point that you mentioned within the comment is around, the kind of hidden experiences of people within the BAME umbrella phrase. And I think I did touch upon that while I was going through the presentation. We are very wary of that, and we understand the nuances that exist for different ethnic minority groups and the experiences they may have had of COVID-19, and certainly experiences of any structural inequalities that exist as well. And I think we've tried to present that as in a balanced way as possible, because what we don't want to do is negate any of those experiences, but we also cannot go into every individual group's experience separately. So there are some common themes across the board which we've tried to bring out and address, while acknowledging that there are going to be nuances within that.
Thank you very much. And you see LJ is chasing you down, actually, asking you another question in the chat box.
Sorry, I can.
It just says, can you tell me the voluntary organizations in the Caribbean community? Maybe I'm going to suggest you and LJ have a direct conversation, and I know LJ will follow you up to get you on her radio station. And then actually, if you don't mind me saying, the next question, Tony Guest had one already, but I'll put this one as well because it follows up. It says the hyperlocal stations have played a critical role in the pandemic. Yep. So continuing support, but more importantly, what can we give assurances that radio stations will be supported through this? And I must admit, Tony, I haven't got a good answer to that. But Mubashir, any thoughts that you've got on helping the voices here?
So I mean, I think we are trying to bring about as many voices as possible through both the report and some of the follow-up work that we hope to do. And while not necessarily directly linked with the report, we within the CA, we want to work quite closely with the community groups and organizations to address some of the factors, both from the report and wider in terms of health and well-being, which work best when we work with the community. So one of the key things, like I said, in the report is around people-powered health, and that is all about taking advantage of community assets. And so what, your channel, people working as champions within the community are what we would consider community assets. And certainly there will be opportunities for us to be able to work with you and support you in whatever way is possible.
Thank you. Now then, I'm looking now at hands. I've got 4 hands who've already asked a question. Faisal, Irfan, Timur, and I know Lauren wants to come in. But are there any other new hands that I can't identify? Anybody, if you haven't asked a question yet and you've got your hand up, do just pop in, because I think everybody whose hand up has already asked. Nobody jumping in. All right. Well, very quickly then, we'll just go through those second rounds round, but it will be quick. So Lauren, you're first.
Hi there. Hi again.
Yeah.
I'm just wondering, what has been the level of compliance with restrictions in regards to the BAME community?
I'll give an answer to that if you don't mind me saying, because there's been some nonsense said in some parts of the country. Our experience has been extremely good, and I think that is a very strong reflection of the unity of communities across the whole of the West Midlands. So I am very proud to say compliance has been extremely good here, and I think one of the reasons for that is a very good effort, and I'm sure this went on elsewhere, has been put into making sure that leaders of communities have actually had all the information and been able to share those stories. Is that clear, Lauren?
It is, thank you.
Lovely. And then there is a new hand, so let me go straight to that. Asif Mahmood, over to you.
Hello, thank you, Andy. First of all, we need to say thanks to our NHS and frontline worker.
Correct.
They are really do a very positive role in front of during the COVID-19. Andy, I'd bring your attention to, because you all West Midland, Black ethnic minority, a large number of people that doing taxi as a private hire and as the other taxi, because you in charge of the West Midland transport as well. But during that pandemic, I think we need to check with them, because of 7 different councils, they got 7 different roles. Some taxi drivers, they had some little bit grant from the council, and some of them not. How come is whole West Midland combined authority and then 7 different rules? Can you check with that? Because the Black ethnic minority, large number, they are doing the taxi driving, and then they're really in this situation, they're really doing hard work. But we need to look after them as well if we need to combine the community in a whole region.
Yes. Now it's slightly okay. So I need to answer this one myself. I can't pass it to the health experts. So it is tricky, this, Atif, because as your question draws out, they are responsible to their licensing authority, which is a local authority, not the combined authority. And obviously what support they get also depends on how their business is structured, whether they're open for grants as a self-employed person, for example. So it is different. What I think should be said, though, is that in the main, taxis have played a critical role, particularly, of course, making their vehicles safe. And there was all sorts of work in terms of price competitiveness as well, to make sure they can still offer the service that people rely on. But I can't step in and have a standard arrangement, because that is actually an LA responsibility. I'm sorry, Asif, but I can't overstep the mark there, because the licensing does not fall to us. But you're right to call out their critical import to what's gone on. Okay.
All right.
Thank you. Sorry, I can't say more than that. Let me next go to Faisal, penultimate, maybe last but 2 questions.
Do we have exact and real figures for coronavirus cases with Birmingham for BAME communities?
Lola, do you want to answer this? You're on mute, Lola.
Sorry, I put myself on mute. Yes, local authorities will have data of the position in their Black and minority ethnic communities. I think we just get a basic subdivision as to the proportions of cases that are white, Black, Asian, that sort of subdivision, and you should be able to get that from your local authority directly.
Yeah,
thank you.
It is. The information is available, and actually, the leader of the council, Councillor Ian Ward, does comment on this on the Friday press conferences. And Faisal, it'd be a perfect opportunity, plugging this again, if you were to come on that, he'd be very pleased to answer the question, because they definitely have that data. Okay.
Thank you.
Lovely. Irfan, penultimate question.
Thank you so much, Andy. My 2 questions are, due to the coronavirus, it was mostly ethnic minority members and women generally who lost their job. What have you done for them? My second question is, hospitality sector has suffered huge loss due to the virus. What support did they get from the government?
Okay. So again, I think they're probably for me. There's more questions about the economy than I expected on this call, but that's okay. Hospitality. So this is something I'm actually very pleased about. When we went into tier 2 restrictions, you might have seen me on the television news that night saying the hospitality sector that really couldn't operate needed direct support from the government, and it got it through the change to the job retention scheme terms. So they were able actually to get substantial support, even though they weren't closed, that they were able to get that tier 2 support. And that money actually across the whole region for a month was worth about £60 million. So a really important concession from the Chancellor. In terms of job losses and replacements, I mean, however one dresses this up, there are already serious job losses and there will be more. And you are right, they are affecting young people more than any other group. And there is a disproportionate concentration in BAME groups as well. But it's the youth thing that is more important than anything else. So what we are doing with government agencies is really trying to work to get retraining opportunities, companies to take people back on. And again, one thing I would really promote to you all is the Kickstart scheme, which starts at the beginning of November, and the government pay all the costs of taking on a young person for 6 months. And we need businesses to step forward to offer to do that. And we actually had the national launch of that scheme with the Secretary of State in Coventry on the 2nd of November. So if you could have, and that's the thing to promote, because your business readers, and Asif as well, your business readers, they can get that support from government to take young people on. Hope that answers clearly. And then I think the last question is back to Timur.
Yes, Andy, thank you very much. End of this meeting, I can say that you can talking about for the radio that they can voice our is a pandemic situation. On the other hand, we can use a mosque, temple, and a church worship places. You as a whole, the West Midland is a mayor. You can go in these places and give a good message for the people. If you can use these places as well.
Well, the question is that. So, Lola, do you want to answer that or say anything about that, or shall I?
Well, I mean, I think Tamar makes a really important point that we need to galvanize our faith communities because, you know, they are in contact with a lot of people, and these are good venues for really sharing some of the accurate messaging that we need everybody to be aware of. And I'd be fully supportive of you know, getting our faith communities and faith leaders involved in this.
Okay.
They already
Thank
are. Yes.
you. And I've just got one last thought, actually. Asif, your question about taxi drivers, I think there's more we can do to help them understand what's available. So I'm going to come back to that. I'm going to ask Suki just to follow that up afterwards, actually, because there's quite a bit there depending on how they are employed. So we'll just come back to that. Right then. So it is 12:15, which is when we said we would finish. So we probably should do so. I think I've given everyone the chance to ask questions. I know some of you have asked, might have a third or fourth question, but we should probably leave it there. So can I just say thank you to everyone who's participated, of course, to Mubashir and to Lola for answering the questions. And of course, we would love you to really, to come to LJ's point, we'd love you to feature this report in your own media, because that's the way it will have impact going forward. And if anyone wants to come on the press call open to all press Friday at 2 o'clock, you are very, very welcome. Okay, thank you all very much, and bye-bye.
Thank you so much.
Thank you.